Your heart may be trying to tell you something important even if you do not notice. Most people think heart problems only cause chest pain, but there are many other signs your body may show. Because the heart works throughout your body, when it is struggling, clues can appear in different places. In this script, we share 11 unusual signs that could point to heart problems. Knowing these signs early can help you get help before a serious event happens. Number 1. Calf swelling or pain. Sometimes, the first sign of heart trouble is pain or swelling in your legs, not chest pain. If your calves become swollen or hurt when you walk, it could mean that blood is not flowing well in your legs. This problem is often due to narrowed blood vessels, which makes the heart work harder to pump blood. If you notice your calves are regularly swollen or painful, it is wise to visit a doctor for a checkup. Keep an eye on any changes in your leg size or discomfort during daily activities. A gradual increase in swelling might indicate that your heart is under extra stress. Simple remedies like resting or elevating your legs might help temporarily, but they do not solve the underlying issue. Early detection and treatment can help prevent more serious complications. Number 2. Swollen calves. In addition to pain, simply having swollen calves can be a warning. When you spend long hours walking or standing, you might think the swelling is due to tired muscles. However, swollen calves can also signal that your blood vessels in the legs are blocked or narrowed. This blockage forces your heart to push blood through tighter spaces, which can eventually weaken the heart. If calf swelling continues even when you rest, it could be a sign of a bigger problem with your circulation. Notice if the swelling comes on suddenly or lasts longer than expected. This type of swelling may also be accompanied by a feeling of heaviness or tightness in your legs. Keeping a record of these symptoms can help your doctor understand what is happening. Addressing this early on might prevent further strain on your heart. Number 3. Erectile dysfunction. For men, trouble with getting or keeping an erection can be more than just a personal or sexual issue. The small blood vessels in the penis are often affected before larger arteries do. When these vessels narrow or become blocked, it may be an early sign of heart disease. In many cases, erectile dysfunction appears 2 or 3 years before more obvious heart symptoms occur. If this problem persists, it is a good idea to have your heart checked by a professional. This symptom may also come with other subtle signs like reduced stamina or energy. Addressing erectile dysfunction early could help detect underlying heart issues before they become more serious. Number 4. Bleeding gums. Bleeding gums might seem like just a dental problem, but they can signal more serious issues. Constant gum bleeding may show that there is inflammation in your body. Bacteria from gum disease can enter the bloodstream and contribute to the buildup of plaque in your arteries. This plaque can then narrow the arteries, increasing the risk of heart problems. Maintaining good dental care is important for your overall health, including your heart. Number 5. Extreme weakness. Feeling very weak or tired suddenly is not something to ignore. Unlike regular tiredness, extreme weakness may not go away with a good night's sleep. This kind of fatigue can occur when the heart struggles to pump enough blood to your muscles and organs. When the body does not get enough oxygen, it feels drained and exhausted. Sudden, severe weakness could be a sign of a heart attack or another serious heart condition, and it needs immediate attention. Number 6. Skin changes. Your skin can also provide clues about your heart health. Noticeable changes like a blue tint on your lips or fingertips might indicate poor blood flow. You may also see small, painful red spots under your fingernails. While these skin changes may seem minor, they can be a sign of problems in your blood vessels or even infections affecting your heart valves. If you observe any unusual skin changes that last for several days, it is important to discuss them with your doctor. Number 7. Digestive problems. Heart issues can sometimes hide behind symptoms that look like digestive problems. Nausea, indigestion, or stomach pain might actually be a sign that your heart is under stress. The nerve that connects your heart to your stomach can trigger these discomforts when the heart is not working well. If you experience persistent stomach pain, along with other symptoms, such as shortness of breath, it is wise to get checked. Ignoring these signs might delay important treatment for heart problems. Number 8. Persistent hoarseness. A hoarse or rough voice that does not improve may also be a warning sign. When the heart cannot pump effectively, fluid can build up in the lungs. This extra fluid can affect your vocal cords, causing your voice to become hoarse. In some cases, a chronic cough may develop along with this hoarseness. If you have a consistently hoarse voice and no clear reason, such as a cold or allergies, it might be time to have your heart evaluated. Number 9. Fainting episodes. Fainting or passing out without a clear reason can be another signal of heart trouble. When your brain does not get enough blood, you might lose consciousness for a short time. This brief blackout, known as syncope, can occur because the heart is beating too fast, too slow, or in an irregular rhythm. Fainting episodes that happen during physical activity or emotional stress should be taken seriously. They may indicate that your heart is not sending enough blood to your brain. Number 10. Excessive sweating. Unusual or excessive sweating is not always just from heat or exercise. If you experience cold, clammy sweat that seems to come out of nowhere, it could be linked to heart problems. When a heart attack happens, your body may release stress hormones that trigger heavy sweating. This kind of sweat is different from the normal sweat you get on a hot day or during exercise. If you notice unexplained sweating along with other symptoms like chest pain or shortness of breath, it is important to seek medical advice immediately. Number 11. Sudden weight changes. Unexpected weight gain or loss can also be a sign of heart trouble. Rapid weight gain might be due to fluid retention, which happens when the heart does not pump well enough. On the other hand, losing weight without trying can mean your body is breaking down muscle and fat because it is not receiving the nutrients it needs. Keeping track of your weight every day can help you notice these changes early. If you see a sudden change in your weight along with other symptoms such as swelling or extreme tiredness, please consult your doctor. Taking care of your heart is essential for a long and healthy life. Regular exercise and a balanced diet that includes fruits, vegetables, and whole grains can help strengthen your heart. Keeping track of your blood pressure and cholesterol levels is also important. By watching for these 11 signs, calf swelling or pain, swollen calves, erectile dysfunction, bleeding gums, extreme weakness, skin changes, digestive problems, persistent hoarseness, fainting episodes, excessive sweating, and sudden weight changes, you can catch heart issues early. Remember to like and subscribe if you found this information useful. Early action can make all the difference between a minor problem and a life-threatening emergency. Stay aware, care for your heart, and be sure to talk with a doctor if you notice anything unusual.